Good morning, everyone. It's 9:30 on the dot here in Saskatchewan, so we'll go ahead and get started. Good morning. Thanks for joining us for QI Power Hour this morning. My name is Chelsea Schwartz with the Saskatchewan Health Quality Council. Great to see some familiar names on the call today. I know that folks are continuing to join us. Also great to see some new names. So if this is your first QI Power Hour session, a very special welcome to you and a bit of background. So this is a free monthly webinar series hosted by the Saskatchewan Health Quality Council. And we bring together a variety of learners from a variety of sectors to learn more about quality improvement. And we always get this question at least once, so rest assured that today's session is being recorded and will be posted to our Health Quality Council website following the session. So if you take in this session and know some others who might be interested in this topic, please feel free to pass along the link to the recording to them. And we also invite you to check out some of the past sessions that you might have missed. While you're there, we invite you to sign up for our distribution list, and this will make sure that you stay in touch with us. So you will get advance notice of our upcoming sessions, and you can take into the ones that are timely and relevant for you. And we have just been so delighted over the past few years to see how our community of learners continues to grow. So this offering was originated in the healthcare sector, as you may have noticed from our name. That's where we were born. But we continue to see uptake and participation from new organizations every month. And we're just so grateful for the privilege of your time. So we've seen great spread and uptake throughout our home province of Saskatchewan, but also across our country of Canada, and in fact across the world. And so really when we talk about a community of learners, that's exactly what we intend this to be. And some of our favorite things that happen during QI Power Hour is also leveraging the wisdom of this crowd. So we invite you to share with your peers today any ideas and questions and resources that you may have on the topic of program evaluation. You can do that by contributing in the chat. So for those of you who are new to the WebEx platform and maybe a bit unfamiliar of how to access that, you can access the chat platform by clicking on that message bubble at the bottom right-hand side of your screen, and this will launch the chat menu. We do invite you to select in the to field everyone so that we can all participate in the conversation. So I'm just going to give everyone a moment to locate that function and maybe introduce yourself and either the organization that you're joining from or the location that you're joining from. Just give folks a few moments. Perfect. Well, while you're locating that, I am delighted to introduce our speaker today. So our very own Alvin Yap, who is an improvement lead here at the Health Quality Council. So Alvin has been with us for a couple of years now. He joined the Health Quality Council in December of 2020. And as an improvement lead, he works on a variety of projects aiming to improve healthcare in Saskatchewan with a particular focus on measurement. So that's why we invited him this morning, because this is squarely in his wheelhouse. Prior to working at the Health Quality Council, Alvin worked in Alberta as a researcher and evaluation coordinator with Alberta Health Services, coordinating the evaluation of programs and services on a provincial level, and later as an evaluation specialist with the Edmonton Oliver Primary Health Care Network, leading evaluation of clinic, program, and network level initiatives. Alvin holds a Bachelor of Science with a specialization in psychology and a Master of Education in Measurement, Evaluation, and Cognition, both from the University of Alberta. So we're in excellent hands today. Thanks so much for sharing with our community, and I'll pass it over to you, Alvin.
Perfect. Thank you, Chelsea, for that lovely intro. I'd like to lead us off just with a bit of a land acknowledgement. So the Health Quality Council of Saskatchewan is situated on Treaty 6 territory, as agreed upon by Crown representatives and Cree, Assiniboine, and Ojibwa leaders on August 23rd, 1876 at Fort Carlton, Saskatchewan, and on September 9th, 1876 at Fort Pitt, Saskatchewan. And something I like to do with my land acknowledgements is each time I need to do one, that I do a little bit of research about what Treaty 6 actually is. So this is the treaty of the land that I am currently residing in, that HQC is situated upon. And part of that is because I feel like our education was a bit lacking. We've heard about British North America, we've heard about Confederacy, we heard about all that stuff, but we didn't really hear much about the treaty. So I kind of wanted to rectify that. Each time I do a land acknowledgement, I try to want to learn a little bit something. Here's actually a presentation copy of Treaty 6 that was distributed around after it was signed. And you'll notice one thing is that it is written in English, and there are no Cree, Assiniboine, or Ojibwa copies of it. And that's because the indigenous people were disadvantaged during the signing of Treaty 6 because the document was only written in English. Their interpreter needed to explain the words, meanings, and concepts of the treaty text, and because of that, some miscommunications have been claimed since then. The indigenous people thought that the crown didn't want to buy the land, but instead borrow it. And of course, we know that's not true. That the indigenous people could choose the amount of land that they wanted to retain, which was also not true. And that the treaty would adapt to changing conditions. And some believe that the treaty terms should be reevaluated to better suit the needs of the indigenous peoples today. I acknowledge the trauma and suffering caused by the various governments and individuals of Canada who did not adhere to the provisions or the spirit of Treaty 6, leading to famine, the withholding of supplies, and the kidnapping of children through residential schools. I reaffirm my commitment to reconciliation and give thanks to the Indigenous peoples for welcoming me to their lands where I raised my family. So diving into the outline for today, we're going to go over what evaluation is and how it's different from research and quality improvement, but also a little bit about how it's similar to quality improvement. We are the QI Power Hour after all. Um, then we'll talk about the three approaches to evaluation. These are the three main approaches to evaluation. Just briefly, summative, formative, and developmental. We'll talk about who an evaluator is, and then we'll close with how to conduct an evaluation. So what is evaluation? Dr. Cheryl Poth and friends, of which I was one, in 2014, worked to define evaluation within the Canadian context. We thought that within Canada, we should have, a made in Canada definition for evaluation. We've interviewed evaluators, users of evaluation, stakeholders, and people who read reports, that kind of thing. We surveyed them and we interviewed them, and we found that not a single definition exists among evaluators, and that not only is there no single unifying definition, that this single unifying definition might not even be desirable because evaluation is such a diverse and complex field. That has lots of different approaches, lots of different kind of goals, depending on who the users and the practitioners actually are. That said, the professional organization, the Canadian Evaluation Society, still wanted to have a working definition that they can put on their website. So this is what they came up with, that evaluation is a systematic assessment of the design, implementation, or results of an initiative for the purposes of learning or decision making. And I think that's a good working definition that we can kind of tweak and mess around with a little bit as we need. It is both firm and yet flexible. So one way we can look at what evaluation is by comparing and contrasting with research and quality improvement. So from Fraser Health in 2017, they determined that research, the purpose of research, is to generate new knowledge that is generalizable to the wider population. Purpose of quality improvement is to improve internal processes, practices, costs, or productivity for a specific intervention. And program evaluation is there to inform decisions, identify improvements, and provide information about the success of programs according to predefined goals and objectives. And that predefined is going to be very important as we look on later on. It's one of the ways that we kind of tackle bias in program evaluations of things like pilots that you want to succeed. There's also three main evaluation approaches, as I alluded to in before. We have summative evaluation, formative evaluation, and developmental evaluation. And in summative, you're looking at the overall judgment and merit of worth of a program. So you're answering the question, was this program successful? Formative evaluation, that's more for program improvement. How can this program be improved? And you can kind of see the link there with quality improvement. And developmental evaluation is there to support developments of innovation and adaptation in dynamic environments. What direction should we take this program next? So we've got a little comic up ahead. Sorry, before that, we're going to go into just how developmental evaluation links to quality improvement. And so here, since it's the QI power, I'm sure this is familiar for most of you, but we'll kind of pause. We'll take us out of the program evaluation world and go into the QI world a little bit. And this is a PDSA cycle, a plan, do, study, act cycle. The image you see here is the System of Profound Knowledge from the Institute of Healthcare Improvement, the IHI, and it describes a process for identifying a target and using a cycle of plan, do, study, and act to achieve that goal. So here you can see, you're looking at what you're trying to accomplish, how are you going to know that a change is an improvement, and what change can we make that will result in an improvement. And what we find in developmental evaluation is that it is just multiple plan, do, study, act cycles kind of throughout the initiative. So you have one PDSA cycle lead into another one and lead to another one. So a quick analogy with food. Summative evaluations are kind of like your customer at the end of the day at the restaurant. Eating the meal and saying, "It tastes great." The formative evaluation would be analogous to the chef tasting the food as they're cooking it and thinking, "Oh, it needs a little bit more salt," so you put that in there and make that meal a bit better. And then developmental evaluation is the kitchen team or staff or chef going to the farmer's market, looking at seeing what's available and seeing what would be good for today's menu. So in program evaluation, you'll see a lot of this style comic, and that comes from Chris Lacey of freshspectrum.com. He draws a lot of these kind of program evaluation comics, and you'll see them sprinkled throughout pretty much all program evaluation presentations. So we know a little bit about what evaluation is, at least at a surface level, and we know about a little bit about the approaches to evaluation. Who is an evaluator? The snarky answer is someone who evaluates. And there is some truth to that because anyone can evaluate something. And I would actually say that you could be an evaluator, and you might have to be on your team if your project has budget constraints and you can't hire on a full-time evaluator to do the program evaluation. That might be a requirement for a grant or something like that. We find that a lot of people do evaluation kind of on the side of their desk. But that said, it is something that we do all the time in our daily lives as well. So you're probably already an evaluator. We'll take a look at our definition again, and we'll kind of just strike out this busy kind of text and simplify it to evaluation is the systematic assessment of an initiative for the purpose of learning or decision making. And the initiative can be what to purchase, and that could be a vehicle, phone, TV, something like that. When you're looking at what you want to buy, you're going to be doing an evaluation of what is going to meet your needs. So whether you're purchasing a vehicle or you're purchasing a phone, TV, or you're making a move to another city, you're going to be doing evaluation there. So if everyone's an evaluator, what makes professional evaluators special? And really it comes down to the education and experience in evaluation methods, and then the soft skills of like working and leading stakeholders. The more technical answer of who is an evaluator can be answered by our Canadian Evaluation Society. They have decided that an evaluator, a credentialed evaluator, would have 36 competencies across 5 different domains. And in order to get this credentialed evaluator badge, you need to go through a rigorous application process to demonstrate achievements of at least 70% of each of these 5 domains. So I'm not going to go into all of them, but here's each of the domains. And each of the competencies that you need to have. And then here's a diagram of the application process. So it's pretty rigorous. They give you 3 years to kind of go through all of this because it's going to be one of those side of your desk things as you work through. And then once you've gotten all of that, you get a shiny credentialed evaluator badge. I would say most evaluators in the field don't have this credential, and I wouldn't say it's absolutely necessary. But once you see someone with this credentialed evaluator badge, the CE designation after their names, that's how you know that you've got a legit evaluator on your hand. So something evaluators struggle to do is explain to children what their jobs are. And it's one of those things like I've given you an explanation of what an evaluator is. Can you now kind of explain what this is to children? And that's a challenge when, there's a lot of professions that are relatively easy to explain to children, but evaluators struggle with that. Excuse me. And so one of the evaluators, Roger Miranda, tackled this problem by writing a children's book. It's titled Eva the Evaluator, illustrated by Bridget Stadler, and is written to address explaining evaluation to children, but it's also become a tool to educate adult clients as well. The gist of the story is Eva comes home from school where they talked about their parents' job. Mom is a doctor, that's relatively easy to explain, but she didn't know what her dad does as an evaluator. And so the plan was to kind of show the video. It's about an 8-minute long video, but we were running into technical issues of it. So I'll just put a link here for you. It is read by Michael Quinn Patton, who is the godfather of developmental evaluation and utilization focused evaluation, and his daughter. So just something for you to watch on your own time later. So we know what an evaluation is. We know who evaluators are, you probably. How do I do an evaluation? So there's lots of different approaches, methods, tools, statistics, programs, etc. The American Evaluation Association has over 60 topical interest groups looking at each of these kind of methods, tools, programs, just a sampling. There's collaborative, participatory, and empowerment evaluation. There's mixed methods evaluation. There's research technology and development evaluation. So there's lots of different kind of topical interest groups, lots of different methods, lots of different tools out there, and it's really easy to get overwhelmed. Once you gain more experience, you can bounce around different tools as needed for the situation. And this is where the value of a professional evaluator comes from, because they have that familiarity with different tools, different situations, and they can kind of use each as is necessary. But for a novice or a beginner, or even just someone who's completely new to evaluation, I found that the Better Evaluation Rainbow Framework really gives you a good structure of evaluation and a detailed list of things to Google if you kind of come across problems. So what the Rainbow framework is, it looks like this. And it can be used to plan an evaluation or to locate information about particular types of options within your evaluation. So you kind of go from loosely from the top to bottom, manage, define, frame, describe, understand, synthesize, report. And you can see an example here of when you go into describe, it tells you here's the steps you need to do. And then also here's some tools and options that you can use to be able to complete that task for your evaluation. So it's pretty big, but I'll give a kind of a brief overview of it and then give some of my own personal tips and experience from it while leaving you kind of with the resources to explore yourself. So the first big bucket of work is you need to be able to manage your evaluation or measurement and evaluation system. So in this bucket of work, you're going to be deciding how the evaluation or the measurement and evaluation systems can be managed, including clarifying stakeholders' roles and decision-making processes, and ensure processes for these are transparent and well managed. My tip for this is in your initial meetings to set project goals, member roles, stakeholders. And this is where things like a project charter or a team charter would come in handy. And it's definitely something that you can kind of revisit as needed. So you can see there, yeah, the project charter is a good tool. We also use Mural's another great tool that we use within HQC a lot, where everyone can kind of put post-its around and share ideas live with each other and virtually, especially which is kind of a necessity now in today's world. But yeah, set checkpoints in there to kind of stay on track and revisit as needed. Our next big bucket of work is to define what is to be evaluated. So here you're going to develop a description or access an existing version if you're kind of inheriting an evaluation project of what is to be evaluated and how it is understood to work. So my tips from that is to build off your initial discussions, and here's where you can grab onto things like program theory or develop a theory of change. A logic model is really useful here. And probably my most important tip for this is to involve as many perspectives as possible. So if you're doing an evaluation within a primary care physician clinic, for example, you'll want to get representatives from the physicians, nurses, the clinic managers, the medical office assistants, MOAs, and even the patients because you just never know what one perspective is going to bring to the table that you might miss otherwise. The next big bucket of work is to frame the boundaries for an evaluation. So here you're going to set the parameters of the evaluation, its purpose, key evaluation questions, and the criteria and standard that are going to be used. And here's where something like an evaluation framework would come in. So it's a big table where you kind of lay out your evaluation questions, your metrics that you're going to use to answer those questions, who's responsible, where the data sources are going to be, that kind of thing. This is a really important tool, especially if you're doing something like a pilot of a program that you're a bit biased and you want this pilot to succeed. Um, because you want to lay out what your criteria for success are ahead of time before you get data and you kind of start fiddling with it. And the temptation for just kind of like hunting for successes within the data kind of comes through. So really important out there. It's a really good communication tool as well. And it kind of helps you show that you're trying to be as transparent as possible. So not all evaluation frameworks need to be in the shape of a table. Sometimes you have cyclical programs that are kind of going through, or one that feeds into another. So don't feel that you're restricted to a table. Whatever visualization kind of makes sense for you, um, go for it. As long as you kind of have that kind of information there. So one of the important parts of the evaluation framework is developing evaluation questions. So I thought I would delve a little bit deeper into that. The types of evaluation questions that you're going to be writing are going to be dependent on the type of evaluation you're doing. So summative, formative, or developmental, and also the purpose of your evaluation. But just in general, here's some general tips. The first is just to keep them open-ended. So an example of a closed question is, did participants enjoy the program? It's really easy to answer that question with a yes or a no. So we want to avoid yes, no, closed kind of answers. So an open version of that could be, how do participants characterize their experience? So leaving that open for them to kind of describe how their experience was. You want to keep your evaluation questions broad. These are not survey questions, but you can use survey questions to answer evaluation questions. So a survey question could be, how satisfied are you with the timeliness of the email from your support worker? And the evaluation question, that survey question would answer it, to what extent are services delivered in a timely fashion? So you can see that little tweak there. You can also use multiple indicators to answer a single evaluation question. So the evaluation question of, to what extent is the program having a positive impact on families? And your indicator there could be parents' self-reported ability to attend the training classes, their satisfaction with the training classes, the effect on the children maybe afterwards. You can use multiple indicators to measure a single evaluation question. Our next big bucket is describe activities, outcomes, impacts, and context. So this is where we're going to be collecting and retrieving data to answer descriptive questions, such as what has happened in terms of the activity of the program, project, program, or policy, the various results it has had, and the context in which it has been implemented. So here's our big data collection and analysis bucket. My tips for this is to find processes that are already existing in whatever it is that you're evaluating and tap into that for your data collection. So if you're working in a clinic and they're using an electronic medical record, see what you can pull out of that that's already kind of embedded in their current workflow. That'll give you access to the historical data as well as data going forward, and maybe you can kind of tweak processes to kind of improve that as you're working in the project. And the next big tip is to automate as much as possible. That allows for rapid analysis reporting, and it improves the timeliness of how people are getting information, feedback, data, that kind of thing. And the way you would do that is to create links from Excel to Word. So as you're doing your Excel figures, that automatically populates a report in Word. You can also use things like statistical programming languages. So this is like R, Python, a little bit more advanced, and then also Markdown languages. And the big thing here is don't let perfection get in the way of progress. This is my big flaw. I sit there and I tinker with reports and I try to make it look just right and perfect and get all the analysis exactly right. And then it's been a month past since I was supposed to have it in, and now that everybody's kind of moved on and lost interest in the data altogether. So don't let perfection get in the way of progress. Sometimes a little bit messy, rapid kind of feedback is better than a perfect report. Our next big bucket is to understand causes of outcomes and impacts. So here you collect and analyze data to answer causal questions about what has produced outcomes and impacts that have been observed. So the gold standard of causation is the double-blind randomized control trial. Unfortunately, most of us doing evaluation projects, we're not in research. We're probably not going to have that, but we can start to approach causation um, if we follow these 3 steps, basically checking that the results are consistent with causal contribution. Does that make sense based on your theory of change, your logic model? And then comparing the results to the counterfactual. If you have a control group, that would be great. I would definitely recommend setting up a control group if ever possible. Um, and you're really looking at what if this intervention didn't happen? And then also investigate possible alternative explanations to what happened. Think about something that maybe you didn't think about at the onset. Did something else come up that could explain this? Maybe try to bring in a different perspective to look at your data or your methodology and see, is there something else here at work? The next big bucket is to synthesize data from one or more evaluations. So you can combine data from one or more evaluations to form an overall assessment of the merit of or worth of the intervention, or to summarize evidence across several different evaluations. So my big tip here is triangulation is super powerful. This is where you take multiple data sources that are measuring the same thing, but from a different perspective or a different kind of data source. So the image there shows you an example of if you're trying to look into something, you'll start with a literature review to see what the literature says. You'll maybe survey practitioners to see what they think, and then do an in-person interviews with expert panels. So now you're getting a different look at a single phenomenon from different angles with different perspectives. Another really important thing is to employ expert panels, especially in healthcare. Most of us who are doing evaluation, quality improvement projects, we don't have that clinical training to interpret clinical findings. We can find statistical significance of things, that's great, but sometimes that's different from clinical significance. I'll give you an example of that. I evaluated a 12-month diet and exercise program where patients were brought in and they were given like intensive exercise and diet instruction for 12 months. With the goal of losing weight, decreasing their BMI and improving clinical indicators related to metabolic syndrome, or that's like pre-diabetes. So we looked at clinical indicators pre and post the program, and we found that there was no statistically significant difference in the clinical indicators of BMI, HbA1c, and LDL, which was for me, not fun. The We worked really hard on this program. All the clinicians were kind of disappointed with that result as well. But then, we brought this data to a clinical expert panel of 4 family physicians, and we interviewed them all separately. And we asked them, what is the clinical significance of this finding? And all 4 of them said, yeah, it would have been better if we saw an improvement in their BMI, A1Cs, and LDL. But these are pre-diabetic patients, so they don't have diabetes yet. And if we can keep them on this cusp, and not have them move towards full-blown diabetes, then that is a clinically significant uh, finding. And outcome for this program. So mitigating deterioration towards full-blown diabetes was a clinically significant outcome of our program. Our next big bucket is report and support use of findings. So develop and present findings in ways that are useful for the intended users of the evaluation and support them to make use of them. And here, like, you don't want to write reports that nobody reads. You want the information to be used in some way. Otherwise, you're just kind of just wasting time and paper and energy and all that kind of stuff. So my tip for ensuring that your findings are used is to define a reporting structure as early as possible. Let all your stakeholders know, a monthly report is going to come out to you. I'd like to get your feedback on it. Please, have a look at it at some point. Send feedback by this time, that kind of a thing. Have a plan for the data being collected. If you're collecting data, have a plan for how that's going to be analyzed, reported, and how you're going to use the findings from that. And then you want to automate your regular reporting. So stick to a cadence that facilitates use. If you know there's going to be a board meeting every quarter, try to have that report in front of them for that board meeting for discussion. Don't let it sit there for too long. Include recommendations. And it might be just around data collection or whatever your level of expertise is, but you might want to go out there and get some clinical experts to have a look at things and have them give some recommendations there as well. And then really just have a plan to use the findings. Don't do recreational data collection. Don't do recreational, report writing. Let this have some use and purpose towards improving whatever it is that you're evaluating. So there are going to be unread and unused reports. That's kind of a reality of working in government and big organizations. And take it from me, there's nothing more demoralizing than unread or unused reports. So that's why I put a big emphasis on the use of things and why there's an entire branch of evaluation that's utilization focused evaluation. But what I found is that it's important to build a public record. So even if you know that no one's reading these reports, sometimes it's important to do an evaluation of something that's going on in the current time and archive it somewhere for the future people, evaluators, leaders to reflect upon later on. So don't think that just because no one's read it, it's going to waste. Hopefully somebody will pick it up somewhere down the line. So that's the Rainbow framework, kind of in a nutshell. Brief overview. Um, there's way more to kind of delve into all of this, so I definitely recommend you go out there and take a look at it. I'm going to give you a quick summary, a summation of what we talked about. We talked about what evaluation is, and hopefully you have a good kind of working definition or idea of what that is now. Who evaluators are, someone who does evaluations, that's everybody, and that you might be pushed into that role on a team. We talked a little bit about what makes a professional or credentialed evaluator a little bit different. And then I've also given you that reference to Eva the Evaluator there for you to peruse on your own time. And we also talked about how to conduct an evaluation with tips from and framing it around the Better Evaluation Rainbow Framework. And I'll also leave the Canadian Evaluation Society there also as a resource for you. And some additional reading and watching. The American Evaluation Association had a coffee break webinar. So these are 1 hour long webinars on the Better Evaluation Rainbow Framework, and they go through each bucket. I think each one of them is about an hour each, so they go into more depth than I did. And I think also the authors of the framework themselves are there, so you get to hear from them firsthand. I'll give you a link to the framework right there, and then to the various evaluation associations. And I know that we've got friends from other countries, so I'm sure your country also has an evaluation association or society, professional organization, and just look them up. I'm sure they'll be more than happy to help you. And just a plug for my colleague, Brian Hessler, if you wanted a podcast to listen to that's focused solely on evaluation. He hasn't updated in a number of years, but he's got a good back catalog of episodes. He's got an Eval Cafe podcast that you can go find. And yeah, it's from Brian Hessler, a Saskatoon-based credentialed evaluator with Strong Roots Consulting. And I think that's the presentation part of it, and we can kind of go into question period.
You bet. Thanks, Alvin. And I know that I've cut in a couple of notes in the chat, just inquiring if the slide deck will be available, and you bet it is. I think that it's actually already posted to our website. So these links will be available in there. I know that we've shared a lot of information with you and some things to check out after this to further your learning. So I invite folks to pop their questions in the chat for Alvin. We do have a few minutes to pick his brain some more on some specific details that might be burbling in your heads. But I'll kick us off to just get our Q&A started. So Alvin, I'm thinking about our experience also, in QI, and, a common struggle that we have, or a common tendency, is to want to measure everything, and, what if we don't measure this and we miss the opportunity? But what we also know is that measurement is not free. There's a cost to measurement, right? There's the time and effort that it takes to administer those and collate them and seek to understand. So, what advice do you have for our participants today in terms of striking that balance in their evaluation plan? So, making sure that they have what they need to show, the program's merit, but not getting bogged down in some of that just in case data or things that might, like you say, sit on a shelf.
Yeah, for sure. And the frustrating thing about a lot of these kind of questions in evaluation is it depends. Each project's kind of different, and I would say like if you have a project that is based on a grant funding or anything like that, like those are who you would go to for advice on that. You would ask the grant funder, "Oh, what would you like to see out of this project? What should we measure for you? What would be great for you to be able to hang your hat on this kind of thing." Um, so anytime you have a sponsor, they're kind of a good bet to kind of check to see kind of what information that they would like to have. And outside of that, all things being equal, try to get something that is going to be useful throughout the project and make those kind of your first measures that you tackle. Anything that you can do regular reporting wise to inform either the project itself or the evaluation is going to be where you're going to get the most bang for your buck.
Excellent, thank you. Um, I have another question as we give folks a chance to think of their questions. You spoke a little bit about this, but I just want to pull at that thread a little bit more if we can. So you mentioned the temptation that exists when you're evaluating a pilot in particular. So the whole goal of a pilot is to either secure or initial funding or get renewed funding for a program to exist. So there's some temptations that might be at play there to modify the questions or information that we're getting to suit our purposes. And so I'm wondering if you can share a bit of advice or lived experience that you have for those who might be in that lived experience of completing and evaluating a pilot at present.
For sure. Yeah, we get into a little bit of the ethical issues around this as well. We all want our pilots to succeed, otherwise we wouldn't be working on them. We believe that these pilots are going to be helping the health system or whatever it is system that we're working in some way. But this is why it's important in your evaluation framework as you're putting your questions together, your metrics together, that you have a plan for what to do if your measures aren't what you hope them to be. You don't want to sustain a program or a pilot if it's not doing good or as good as you imagine it to be, solely on the hope that it will get better in the end. You kind of need to have those results as well. So that's kind of where the evaluation framework comes in. Build your metrics, have a plan for whether this is good, this is bad, this is not where we're looking for, and make that transparent. Send that out to all your stakeholders so you're accountable to that plan, and have everybody understand this is where our bar for success is. And if we don't meet that bar and it drops down to list level or whatever it is, that we're going to pull the plug on the pilot and we're going to reassess and maybe re-envision what we can do to make this better in the future. The goal should be to help whatever system or program or company or whatever it is. Um, and we shouldn't be too precious about, the individual initiatives that we're working on.
Great, thanks for that advice. So I think that you've given folks a lot to digest and think about. But it looks like we are quiet on the questions today. But I know, Alvin, that we have talked about you being open and available if folks want to follow up after the session. So I'm just popping a link to our website where you can find Alvin's contact details, and you can feel free um, to check those out as well. Oh, so my apologies. I see that we have some questions coming in now when we make the threat of, oh, we're all out of time for questions. So a question from Justin. Do you have tips for balancing your desire to create the perfect evaluation report, a struggle of mine as well, with the QI needs for regular actionable data for constant PDSA cycles? Ooh, great question.
Yeah, my priority would to focus on the constant stuff, the stuff that you can kind of automate and have regular um, contact with, because the more that you have your stakeholders touch and play with the reports, the more they're going to appreciate when like a bigger, different report kind of comes out. So I would say stick with your constant PDSA cycles, and then kind of off the side of your desk when you can, like bring those pieces in. And one of the axioms that I've been bringing around, everyone at AQC's heard me say this for a while now, is the hardest thing to edit is the blank page. So just dump everything into the document that you're working on, your perfect evaluation report. And I don't know if it'll ever be perfect. I don't think I've ever written a perfect evaluation report. Um, and just keep that in mind. But you'll get a really good evaluation report, and that'll go out in front of stakeholders and hopefully have a good reaction.
We have another question from Melanie. Do you have any advice, kind of the pros and cons, on adapting metrics as a program evolves?
For sure. If you're finding a metric isn't quite measuring um what you were hoping, or you're not getting the quite results, you should definitely like bail on that and then try something else. There are pros and cons to that. The con being like you might be missing your historical data. You're going to be making your data collection people kind of angry. So it's like a bit of change management is going to go a long way there. But I mean, if at the end of the day it's better that you switch metrics, that's probably how you should do it.
Perfect, thank you. Question from Temi. How do you mitigate environmental impacts and politics in evaluation?
That's tricky. The way that I've done it in the past is document as much as possible. Um, Either through like we've done it through like meeting minutes, we've done it through like project documents, that kind of thing. The idea being, if someone's being a barrier, you want them in your evaluation report noted as like a barrier, like, and not to point fingers or anything, but to say this is the barrier that we ran into. Um, this climate didn't allow for us to do this. If conditions improve, this is a way that we would approach it in the future, that kind of a thing. Um, Sometimes you don't get away with that. Sometimes they tell you to take that out of the report, but there's older versions of reports kind of floating around, so somebody will find the truth sometime. is the way that I look at it.
Thank you. A question from Nancy. You made reference to the Better Evaluation Rainbow Framework. Are there other frameworks too that you would recommend as helpful?
I found that one's probably the most like fulsome one that is out there. But there's tons of other resources. I don't have any kind of off the top of my head right now. As I'm running into problems, I Google a lot. So Eval Academy is one that I kind of ran into. That's actually run by a couple of my colleagues in Alberta. And then the Canadian Evaluation Society and the American Evaluation Association, they have a ton of resources on their respective websites that you can poke around and look into. But I would say the Better Evaluation Manual Framework is a great place to go for kind of here's everything, and then you can kind of Google what those things are if you get stuck somewhere, for to find like more detailed resources.
Perfect, thank you. Another question, ooh, I like this one. Would you say that evaluation is an improvement tool?
Yes, I've seen quality improvement used as an evaluation tool, and I've seen evaluation used as an improvement tool as well. There's so much overlap between the two fields. They're really a lot more alike than they are different. I mean, like I'm an improvement lead with the Health Quality Council, and my background's all in evaluation. So that really kind of shows you, and it's just a little bit of a tweak in the line of thinking, right? So program evaluation is kind of more focused on decision making, outcomes, that kind of thing. Improvements are more like small incremental improvements to a program. But then there's formative evaluation, which is essentially a more outcome focused version of quality improvement. So
Great, thanks for your thoughts on that. Um, a question from one of our participants who has been recently tasked with evaluating a program herself. And just wondering if we have any examples of what a good program evaluation would look like. And I believe that there's some on our website under tools and resources. But do you have any that are kind of top of mind for you, Alvin, that you might be able to send out as examples?
the issue with program evaluation is because, and this is me as like mostly an internal evaluator. Most of the reports are not available to the public. They're for like within stakeholders, that kind of a thing. So I don't have any off the top of my head that I can kind of point people to and say, here's a good evaluation to kind of look at. Um, but I'm sure they're out there.
Yeah, it's a good point that they're so context specific and
Hmm.
dependent on what you're trying to, the case you're trying to make, and the specific circumstances. Um, how do we evaluate whether a program is having positive impact on patients, and what is the difference between a survey question and an evaluation question?
For sure. So that's one of like the big things in when we do evaluations of like clinical programs is the impact on the patients. And the frustrating answer is it depends. Um, Whichever kind of program. So if we look at my diet and exercise program evaluation, um, that one we looked at specific outcomes that we were looking at, as well as clinical indicators. So the nice thing about working with patients and in the clinical medical field is a lot of times you'll have those clinical indicators to kind of fall back on. And if you can measure those will kind of be how you can measure whether or not you've prevented them from progressing to diabetes, or if you've improved their clinical indicators in some kind of way. The longer term impacts are kind of harder. So if you've got someone with like chronic illness and that kind of thing, you might have to follow them for longer. So the frustrating answer is it depends. Um, the more helpful answer is to kind of focus on looking at the outcomes of what your um, program is trying to achieve, and how they're going to try and help patients. And the difference between a survey question and an evaluation question is the evaluation question is typically more broad. Um, it's something that is there specific to either a program or an initiative that you're trying to answer, and you could answer that question using any kind of number of indicators. So your evaluation question, it could be to what extent is this program having a positive impact on stroke patients, for example. And then you can have survey questions that try to get at that. You can have assessments that get at that, and then like maybe stroke assessment tools that kind of get at that. So you have one big broad question that is then answered by multiple different kind of indicators.
Perfect. Thank you so much. Well, we covered a lot of ground there in a short period of time. Thank you so much, everyone, for your questions and letting us know what's top of mind for you. So as I mentioned, you can find Alvin's contact details on our website, and he is more than happy to follow up with any questions that we may not have gotten to today. And with that, we want to put on your radar the idea of you potentially coming on QI Power Hour as a speaker. So I know that the main draw to being a QI Power Hour speaker is these beauties of socks that we have for our speakers. So Lisa will be sharing the link in the chat to a template of how you can express your interest in becoming a speaker. So if you have a topic that you think our community of learners would like to hear about, we welcome you to reach out, and we'd love to connect with you. We also invite you to just one more plug to sign up for our distribution list. We're just in the final stages of crafting our session for June. So by signing up to our distribution list, you'll be sure to get notices hot off the press once we have those details finalized. And with that, and in the spirit of continuous improvement, when you close the session today, you'll notice that you're automatically directed to an evaluation survey to let us know where things landed with you today. Just a note that you'll see this this prompt come up, just indicating that you're being taken to an external site. Not to worry, it is a trusted site, and we'd love to hear from you in terms of what went well and things that you'd like to explore into the future. And with that, I'll just thank Alvin once more for sharing your time and your knowledge with us. It's been a pleasure, and you've given us lots to think about.
You're
So
welcome anytime.
happy Friday, everyone. Have a safe and enjoyable long weekend, and we hope to see you again next month. Take care, everyone.